my vision for a better world. A disease can bridge the gap between people. Do you think disease can make a better world? Most of you must be thinking it cannot. But if you had some chronic disease and were really threatened by it, you could understand this contradictory idea. I have a chronic disease, hepatitis B. It is a dangerous disease. 4 years ago, I was in the medical college hospital for 10 months and 10 days. Let me talk about this frustrating but precious experience in the hospital. As you might know, there is no effective medicine for liver disease. And the only thing that I could do was to lie on the bed quietly. Of course, I had some vitamins and a shot of detoxicant every day. But the treatment did not work well at all. During the first month, I could not believe that I was seriously ill. I found that I was talking to myself saying, I cannot be ill, I cannot be ill. A few months passed, and I was becoming more and more irritated and frustrated. And I came to question why my family doctor could not diagnose my disease much earlier. If he had, I might have recovered quickly and completely. My disease was already chronic then. I felt anger toward him. Next came even greater disappointment. The doctor told me that judging from the result of the liver biopsy, my liver was already half damaged, and that the virus was so active that I would have liver cirrhosis in several years. When I was informed of that fact, my thoughts became fixed. I got a tremendous shock and sank into depression. And day after day, night after night, I thought of my wife and son, my parents, my sister, and what little remained of the rest of my life. On the same floor in the hospital, there were many patients suffering from serious liver disease. We talked to each other every day, and most of them were more than 50 years old. I was the youngest. Some of my patient friends often encouraged me. I vividly remember what one of them said to me, Mr. Kageyama, you are young. You have a future. Never give up. You have a family, a wife and a young son. What would become of them if you gave up? For your family's sake, you must recover. This is not such a rare conversation in the hospital, but it moved me very much because I found that I was very self-centered. I had been thinking of only myself, but he was thinking of others' happiness. I felt so ashamed of my egoistical self. That was the most real and the warmest communication that I had ever had. It was beyond the generation gap. He was over 70 years old. It was beyond family-based relationships. He had been quite a stranger before. It was beyond nationalities. He was a Korean. I have never had such a warm communication in my life. I can say, my disease has helped me cross the communication gap. My disease forced me to look more deeply at myself and my world. For me, it has taken shared suffering to realize that the barriers to communication are not as great as I previously thought. Communication barriers can be overcome with effort. Disease has taught me this lesson. Personally, I don't like to preach to or push anyone, but from my experience, I have come to realize that we human beings must see beyond the barriers. A better world begins in ourselves. The future is not seconds, minutes, hours, days, weeks, months, or years. The future is now. When my vision goes beyond the barriers of fear, It is indeed bright. Thank you very much.